I'm Katie Crane from the Pilates Professional. I wanted to go through a couple of things with you today in regards to women and how we feel pain or when we feel pain in our low back. Ignore the spine up here, it's totally messed up, right? And I couldn't be bothered fixing it. But what I want you to look at is down through this area here. As women, when all of our load ends up in our sacroiliac joints, so that's these joints here, SIJ or sacroiliac joints. So normally when we feel back pain, we feel it very low in the back or down through our SIJ or in the very, very low back through here. When we are menstruating or just before we're menstruating, these joints or the ligaments in these joints become a little bit lax, and that's when we can be more susceptible to pain. Now I'm talking about this because I was reminded of this weekend. I went water skiing and I ended up with a sore back, and I thought, oh, that's a little bit unusual because I don't normally suffer from back pain anymore. And then 2 days later I started menstruating, so it was a timely reminder for my body that these ligaments would have been a little bit lax over the weekend, and so they were pulled a little bit, and then I ended up with pain in the lower back, which is really, really common. So some things that we could consider when working with women in particular is knowing when they're menstruating, and also educating women on the fact that just prior to your menstruation or during menstruation, your ligaments are going to be a little bit more pliable or a little bit more lax, so you are going to be more susceptible to discomfort in your low back. And it's important that we don't want to be doing so much ballistic work. So ballistic work might be running, jogging, pounding the pavement, or even doing anything that's too full on. For example, I went water skiing, right? Probably wasn't the best time for my body to be able to sustain something so active. So some things that we can do to help with this discomfort is things like engaging those deep tummy muscles. So I could pop a ball or even pop my hands between my legs and I squeeze in here. So I'm squeezing against my hands. At the same time as squeezing against my hands, I'm pressing out in the legs, and I'm going to hold that for about 5 seconds and then release it. So say you could do that about 5 times, right? First I press my legs into my hands, and then I press my legs apart and keep that pressure for 5 seconds. Then I can do the same on the outside, so I'm pressing my legs together at the same time as pressing my legs out. Hold that for 5 seconds. Do that a few times as well. So ultimately I want to engage those inner thighs, which helps engage those deep tummy muscles. I want to engage through the outer legs as well to engage those deep glute muscles. Some other things that you could be doing with clients would be your side-lying clams, or if you're on a reformer, your side-lying footwork to engage deep glutes. If you've got a core line, or you could be doing on your reformer, your press out and pull in, so your skater series, but you want to make sure that you're not going too far out because you don't want to be pulling those ligaments apart anymore. You want to be doing that type of movement out and in, but with a controlled motion, so there's a sense of those deep tummy muscles drawing back in. What happens is those deep tummy muscles are also inhibited by the discomfort or pain. So I did notice, for example, when I was skiing on the weekend, I wakeboard. So when I've got my feet up on the board and I'm pulling up, I really had to actively engage those deep tummy muscles. Normally they would do their job, but they weren't doing their job so well. And the sorer my back got, the worse those tummy muscles are at doing their job. So those tummy muscles are inhibited by the discomfort. So then you want to do things to re-engage them again, okay? You can also lay with some balls or something right on those sacroiliac joints. But if you're going to do any release work, you definitely want to follow up the release work with some glute work. So you might want to release those sacroiliac joints with your Franklin balls or with your hedgehogs or with your little spiky balls, but then you want to go ahead and activate those deep glute muscles as well, okay? Just some food for thought that during menstruation or prior to menstruation, a couple of days prior to, you are going to have some laxicity. It's really important that we share that knowledge with our customers because not everybody understands that, and that's our job as teachers to really educate our clients and empower our clients with that education. Sing out if you have any questions about sacroiliac joint pain or lower back pain in women, and I can give you some other tips. Have a great day.